Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, the government gives the green light to administer COVID-19 booster shots to fully vaccinated adults starting today. And with more countries detecting cases of Omicron COVID-19 variant, how should the government address the threat proactively? Vaccine expert panel member and infectious diseases expert Doctor Rontgene Solante joins us live. And later, the death of former policeman Jonel Nuesca raises doubts from the family of his victims. Bureau of Corrections spokesperson Gabriel Chaklag tells us more live. Fully vaccinated adults can now be given COVID-19 booster shots starting today. The government says that those who have been fully vaccinated for at least 6 months are now eligible to take their additional doses subject to vaccine availability in the sites. While the implementation starts today, some local government units say they need more time to accommodate booster shot recipients, while other LGUs will have to check if there is enough vaccine supply. Let's go straight to the source of the story. We have vaccine expert panel member and infectious diseases expert, Dr. Rontgene Solante. Dr. Solante, welcome to the source. Thank you so much for your time.
Good morning, Pinky.
Okay, booster now available. Adults 18 and above, and as long as they've been fully vaccinated 6 months thereafter. Can you just tell us what do you think of the timing of opening this now to everybody?
Yes, I think this is very important, especially this is a major step for everyone to avail of these booster shots because we want to maintain protection for the population. And with the threat of this highly or heavily mutated variants of concern, I think we will have really a better chance of containing any mutations as we move along in vaccinating the population and maintaining this protection through the use of these booster doses.
Okay, but also, as we mentioned a while ago, there are LGUs still saying we need to find out if we have enough supply in the vaccination sites. But at least what we know right now is that supposed to be beginning today, those who are eligible can have the booster shots. Doc Solante, talk us through what is the best suited or what vaccine should one get? So let's put up the table so that those who may be wondering, ano bang pinakamaganda para sa akin? That's the table, that's the chart rather of what you can take as a booster. So, but meron ho ba? Because like for most of it, it's definitely AstraZeneca, Pfizer, or Moderna. Meron ho bang better among the three, I guess?
Okay. So currently, when that recommendation was crafted, it's all because all of these vaccines, whether it is homologous or heterologous, are effective. And that are based on data. Like, for example, if you're fully vaccinated with Synovac, a homologous third dose of Synovac is as good also if you give another dose or a dose with mRNA vaccine. No? It may slightly differ in terms of the neutralizing antibody level, but I think not enough or not significantly different. No? And then if you also give AstraZeneca to a third dose of your fully vaccinated Synovac, that's also still a good choice. So meaning, any of these primary vaccine series, when we gave that recommendation, homologous, because a third dose can still boost, elevate the neutralizing antibody. Heterologous, because as much as we want also more protection, a higher antibody, then that's the rationale of these choices. And at the same time, safety. No? So kailangan din natin makita kung among this vaccine, halimbawa, if you are receiving fully vaccinated Synovac and you prefer to get an mRNA, then you would expect an adverse reaction like more pain at the injection site, yung nanghihina yung katawan mo or parang nilalagnat ka. which you didn't expect with Synovac. So
Opo.
those are the things na kailangan mo lang talagang you have to be aware of.
Thanks for bringing that up, because for those, it's also good that you're saying, and I know we've talked about this in the past, dun sa mga nag-Synovac kasi, Dr. Solante, some of them, or maybe even most of them, would want to shift to the Western one or even AstraZeneca. Ano po. But you're saying, I know this is probably the second or third time we've discussed this, and you said Synovac, a booster of Synovac, is just as good for those who took
Yes.
Synovac.
Yes, and that is backed by their data also, that with the neutralizing antibody, no? And we would like to disseminate this important information kasi alam naman natin na talagang mayroong vaccine preference pa rin ang
Opo.
mga tao, no? But in the event na halimbawa ito lang yung i-offers ng isang LGU because this is available, then you have to accept that, because booster, okay, it's unlike the primary vaccine series where you need to stimulate your immune response to make that antibody. With boosting, since you already gave the primary vaccine series, it's just that when you give the third dose, more likely that you have a better antibody response because of the primary vaccine series. That's how important the third dose or the booster dose is.
Opo, you are right, no? Of course, there is preference. Baka sabihin kasi ng mga Sinovac, gusto ko nang mag-AstraZeneca or mag-Pfizer o di kaya mag-Moderna. Very important what you said a while ago. For those who took Sinovac, expect adverse events. Gaya ng sinabi niya, Doc Rontgene, no? Magkakasakit ka, malaki ang posibilidad that you will get sick, manghihina yung katawan mo, sasakit yung pain of the injection site, etc. Why is that? Is that because, in plain lingo, mahina yung Sinovac? Ganun ho ba yun?
Hindi. Dahil sa platform niyan, Pinky, no? Because in Pfizer or Moderna, we use the nanoparticle platform or the mRNA platform using a nanoparticle technology, and there's a part of that vaccine that really will cause more of irritation when you give the vaccine. So that part or component of that, which is an important component of that vaccine, is the one that causes more yung tinatawag natin na reactogenicity. So ano ba tong reactogenicity? There's a possibility that your body reacts more. You'll have pain, more pain, and then you'll have body malaise, or sometimes you'll have low-grade fever. But these are all self-limited and still part of the adverse reaction that we expect sa isang bakuna.
But what about the reverse? Those who had mRNA, can they take Sinovac as a booster?
Okay, since there are no data that a primary vaccine series of an mRNA and then a third dose of inactivated like Synovac available, so we didn't put that in the recommendation. So only for inactivated, it can be boosted with an mRNA or a virus vector vaccine like Janssen or even an AstraZeneca. But for an mRNA, where you will need an inactivated vaccine as a third dose, we don't give that recommendation.
Is there a study regarding a percentage of additional protection na makukuha po ng isang tao na nag-booster?
Yes, malaking may mga data na na mataas ang protection. In fact, yung the data that was really very good was the experience in Israel when they gave the third dose among their 60 years old and above. There was really a significant decrease in the number of those who got the infection. There was a decrease in the severity of those who were infected. And ang pinaka-importante doon, yung hospitalization and death was really significantly low among the vulnerable population.
Let me rephrase that question then. Is there a study that tells you how much of an increase you will have in your body when you have a booster shot? Because sabi niyo nga po, di ba, that's why way back, maybe 2 months ago, the vaccine expert panel already recommended boosters. Gaano ho ba ibinababa yung level of protection after 6 months at gaano po tinataas kapag mag-booster ka?
Okay. So sa mga data, yung pagbaba ng protection, in fact, mas bumaba sila even before the primary vaccine series. Ganun kababa yon. Okay? Now, nung nabakunahan, nung nabigyan ng third dose sa data, tumaas 3 to 4 fold ang pagtaas or pag-akyat ng mga antibody level nila based on the test, no? So that means that when you have that elevation of an antibody protection, then that would also be correlated with better protection attained now with the third dose.
So it increases 3 to 4 times with a booster?
Yes, the booster is really important because it already boosts an existing antibody in our system, just to make sure that that antibody will still be elevated. No? So the ability of the third dose to increase that antibody higher compared to the primary vaccine series. That's why that's the essence of the third dose or a booster dose.
We need to talk about Omicron, but we're going to take a very short break. This is The Source on CNN Philippines. Please stay tuned. You're watching The Source on CNN Philippines. Our guest today, vaccine expert panel member, Doctor Rontgene Solante. Let's talk about Omicron. What is the latest update on Omicron? I was able to watch a press conference, I believe, by the WHO, and sabi nila there will be more information available in the next few days.
Okay, so I think, Pinky, we still don't have much information with regards to this Omicron variants of concern. All we know that it's a heavily mutated variant of concern, and there are mutations, okay, in the spike protein, which are really important, that can affect and that can increase the transmissibility of this virus. There's also a potential that vaccines' effectiveness can be reduced with the mutations. And there's also a possibility that it can also cause reinfection for those who already have a previous infection. And based on symptoms in the initial findings, most of those infected are younger population. So we would expect that symptoms are also very mild, no? But we're waiting for more data, and hopefully in the next 2 to 3 weeks to really concretize what really is this Omicron variant of concern.
Can we clear that up in terms of transmissibility, severity, and even reinfection? There's still no hard data on this. What you're saying is just the possibility of more transmissibility, more severity, and possibly more reinfection. Pero that's not a fact yet as of now.
Yes, because if you look at the specific mutations in the spike protein, so they were able to identify 32 mutations.
Yeah.
Okay. Yeah, 32 to be exact. And there are 9 of those mutations that overlaps with Delta,
right,
Beta, Gamma, and Alpha. And all of these 9 mutations are also been known to increase transmissibility, reduce the effectiveness of the vaccine, and also reinfection. So, what data are we looking at, or waiting? So, the clinical correlation and the testing of these vaccines against this Omicron variant, which will really take time at this point. So, we need to wait for those data.
Last I read, it's been discovered in over 30 countries, the latest of which is India. There have been 2 recorded cases. In fact, India did not even want to reveal where the passengers came from, citing data privacy. But with this already going around, well, that's a lot right there, discovered in so many countries. The Philippine government now, just a couple of hours ago, extended the quarantine period. I say this, Dr. Solante, because yesterday I was talking to Undersecretary Maria Rosario Vergere and asked her about the quarantine protocols. Kasi nga, kapag kunwari galing kang Amerika, 3 araw lang, and so on and so forth. Ano po? And then now, just also to inform everyone, that has been extended to 5 days, I believe. And you must be tested. Everybody, regardless of where you're coming from, needs to be tested on the 5th day. Is this going to give us possibly enough protection with passengers entering the country, with individuals or the public coming in the Philippines?
Yes, that's important. No? So extending the quarantine to 5 days, so meaning you'll be observing the patient for 5 days for the symptom. That's already a good step in order for us to really watch out for those who will be symptomatic. And second, for those, the testing, which is very vital. Getting the tests prior to the flight and then doing the tests third day of arrival. These are really excellent measures, no, to just make sure that all of those travelers coming in will be checked for this possible variant of concern.
Yeah, let me clarify that. They will be tested now on the 5th day. Kasi kahapon pa, nandun pa rin sa 3rd day. Now, government had adjusted that and they will be tested on the 5th day. Just a quick concern about that. From the many times we have talked about this, sometimes the symptoms actually come out on between the 5th to the 7th day. That's why I asked you that question, if we are safe enough with the 5th day testing.
Yeah, so I think that's still enough for the observation. Anyway, they will still be observed even after they will be out of the quarantine. They will still follow the health protocol. And remember, these are also fully vaccinated individuals. No? And I think that's a good measure. And until such time that we see more concrete data of what really this Omicron is, then the policy, the quarantine procedures will also adjust based on those information.
Right. It will evolve, no, as soon as more information becomes available. So now, the good news is, of course, COVID cases in the country have this significantly gone down. More people are vaccinated. Booster shots are now going to be available to everybody. Many companies are considering holding in-person office Christmas parties this year because it is much safer to have these gatherings now compared to obviously last year. What are your thoughts regarding this?
Yeah, I totally agree with that at this point we need to really control and still prohibit big gatherings, no, at this point. We know that we have a very high rate of vaccination, but again, if you have this high-risk exposures like having these gatherings, then that will really be a very bad way of looking at higher risk also of getting the infection. No? Remember, our cases are still there, and we still have the Delta, and Delta alone is already highly transmissible. So until such time, most likely, baka talagang after December na siguro or January, let's see, no, kung talagang mas mababa na yung kaso natin, then we will adjust the restrictions. But importante pa rin, we need to observe health protocol at this point in time.
Para sa inyo po, wag muna, is that what you're saying? Wag muna in-person Christmas gatherings. But what if that happens, Doc Solante? Maybe it's best for you to just give us some advice for those who will insist to have these in-person parties.
Yeah. For me, if we plan to have mga parties sa mga titingnan natin doon, as much as possible, siguro yung mga very close family members and you know that they are vaccinated and at the same time you know that they don't have the symptoms. No? Siguro i-discourage muna natin yung mga outside of the family, manggaling sa mga iba't ibang lugar na hindi natin masyadong alam kung ano ang pinanggalingan, even if they're vaccinated, just to make sure na yung bubble na yan na among the family is maintained. No? And then napaka-importante pa rin when you go out, we need to follow the health protocol because the most important, no, ang talagang protection natin aside from the vaccine is really the face mask and physical distance and of course hand washing and in good ventilation in an enclosed space.
Vaccine expert panel member Dr. Rontgene Solante, thank you so much for your time.
Thank you.
Thank you. And we will be taking a short break. This is The Source on CNN Philippines. Please stay tuned.